Hello everyone, welcome to our channel. Our topic is trials on SGLT2 inhibitors showing cardiovascular benefit. So, several recent trials have shown improved outcomes in NYHA class 2, 3, or 4 heart failure patients already on maximally tolerated medical therapy. And two most commonly mentioned trials are DAPA-HF trial and EMPA-REG trial. So let's quickly write it down again. Several recent trials have shown some NYHA class 2, 3, and 4 on maximally tolerated therapy. That is the maximally tolerated doses with or without the presence of diabetes. Among these, two most commonly mentioned trials are DAPA-HF trial. Another one is EMPA-REG trial. This is nothing but also referred to as emperor reduced. So, in DAPA-HF trial, the drug that was tested was dapagliflozin. In the treatment of heart failure or with reduced ejection fraction. It decreased the mortality due to worsening heart failure by 26%. That was a significant benefit due to heart failure by 26%. Another thing is this was a statistically significant association. Over here, the drug tested was empagliflozin. Again, both of them can be used in plus or minus diabetes. That is either the normoglycemics or the diabetic patients. So, what are the advantages and what are the disadvantages? What is the negative things? Okay, both have a renal protective effect. Both can be used in plus or minus diabetes. So, if used in patients with no diabetes, there is no risk of hypoglycemia, but hypoglycemia was noted in patients on insulin and sulfonylureas, that is the diabetes. It was not seen in normoglycemics, right? And there was a slight increased risk of mycotic genital infections, and these should not be used in type 1 diabetes. So let's quickly go through it again. Trials on SGLT2 inhibitors showing cardiovascular benefit. Several recent trials have shown improved outcomes in NYHA class 2, 3, and 4 on maximally tolerated therapy, regardless of presence or absence of the diabetes. Uh, One such trial is DAPA-HF trial, another such trial is EMPA-REG trial, that is emperor reduced. The drug tested in DAPA-HF was dapagliflozin. The drug tested in EMPA-REG was empagliflozin. Both can be used in the treatment of heart failure with reduced ejection fraction. In the DAPA-HF trial, the reduction in the mortality due to the worsening heart failure was seen decreased by 26%, and this was a statistically significant association. So, what are the other advantages of both of these drugs? They have renal protective effects, and they can be used either in the presence or absence of diabetes. What are the disadvantages? So, hypoglycemia can be seen in patients with diabetes on insulin or sulfonylureas, and it has not been observed in normoglycemics. There is a slight increased risk of mycotic genital infections, and these drugs should not be used in type 1 diabetes.